So I'll be throwing some light into this problem. So before I go into the main problem, I would like to highlight the digestive system or the GI tract. So the GI tract starts from the mouth, then the food travels through the food pipe called the esophagus, and then goes into the stomach. From there, it is pushed to the small intestine, from where the nutrients are absorbed, and then it goes to the colon, and finally it comes out of the anus. So if you look at this picture, the blue part and the green part are the small intestine. The small intestine has three parts, namely the duodenum, the jejunum, and the ileum. Next is the colon. The small intestine is approximately 6 meters long and is coiled and stays in the middle of the abdomen. The colon is another 1.5 meter long, and it starts with a ascending part, then a transverse part, then a descending part, then comes the rectum, and the last part is the anus. So if I have made the presentation so that everyone can understand. I have kept it very simple. Even a 10 years boy or a girl can understand easily. At the same time, a 70-year-old can also understand. And most of my talk will be in English because we have listeners from India, various parts of India, and also abroad like Bangladesh, Sri Lanka, etc. Now, going to how the digestive system works. So once you have taken the food, it travels through the food pipe and falls into the stomach. So stomach, there is acids and other gastric juices, where the stomach acts as a mill and grinds the food which we take. So this is how the stomach grinds whatever we have taken and then converts it into a semi-liquid substance. And this semi-liquid substance is then pushed into the small intestine. Now, if we see the small intestine, the inner surface of the small intestine has multiple folds. So this is basically to increase the surface area so that whatever food we take, it is converted into carbohydrate, protein, fat. So along with vitamins, minerals, everything is absorbed in the small intestine. This kind of movement, which is called the peristaltic movement, constantly keep happening inside the abdomen so that the food particles can move inside and all the nutrients can get absorbed. Finally, once the all the important things are absorbed, the small bowel pushes the content into the colon. The primary role of colon is absorption of water and electrolyte. So the whatever material is pushed inside the colon, it absorbs the water and electrolyte from it. And finally, the leftover fibers, bacteria and all is pushed into the rectum. So the leftovers accumulate in the rectum. And then finally, in the morning or whenever you go for motion, it comes out. Now coming to today's discussion topic is intestinal obstruction. So what is obstruction? Obstruction is block. So normally there is a continuous flow inside the intestine, as you have seen already. So if there is any reason for which there is blockage to this flow, obstruction will occur. So there are various causes of obstruction, and the obstruction or the block can happen suddenly. So if it happens suddenly, we call it acute obstruction. But at times, if the blockage is partial, then or the blockage is not complete, it is called a subacute obstruction. Now coming to symptoms of obstruction. The commonest symptoms being pain, because you have seen that there is continuous movement inside the intestine. So if there is some blockage, the body will try to push the contents. So on that process, if it cannot push, it will send signals in the form of pain, which may be crampy pain. This is followed by a feeling of vomiting, which is called nausea, or at times vomiting when the obstruction is complete. Again, as with time, the food particles and whatever water and everything you have taken along with the intestinal juice starts to accumulate, and this will cause distension of the coils of intestine. So you will have abdominal distension. And finally, because the intestine is unable to throw it outside, so the patient also will develop constipation because there won't be any stool. So these are the main symptoms. Now, if we come to the causes, so what is the cause for obstruction? So if we see, it can be benign causes like herniation of the intestine. You can see that a portion of the intestine has come out, or it can be because of adhesion. So a part of intestine getting adherent to another part of intestine. Then it can be because of twisting. So you can see that a loop of intestine has twisted in itself, or it can be because of sliding part of intestine. More complex cause is tumor. So we know that cancer causes a growth inside and it can cause blockage. So that is a very problematic cause for obstruction. Now coming to adhesions. So what are adhesions? You can see that I already told that there are 6 meter coil of intestine. So if there is some surgery or some infection, or at times even congenital adhesions can be there, so there is bent in the tube. So if the bent is very severe, then there will be blockage to the flow of the intestinal content. So if there is sudden acute fold or acute bend, severe bend, then it will cause acute obstruction. If it is a minor kink or something, then it will cause subacute obstruction. Similarly, if there is a single band of tissue which is compressing from outside, we call it a band obstruction. Again, it can be acute or subacute. Now, hernia is a very important and a common problem. So what happens if patient neglects hernia? So if there was a small hernia, it was not causing any problem and you didn't bother. But what happens is suddenly there is some stress in the form of cough or sneezing, which increases the intra-abdominal pressure. And because of that sudden increase in pressure, a certain portion of intestine may come out as shown in the picture. So if this portion fails to go inside automatically, it will get blocked because it has come out from a very narrow opening, which is the defect of the hernia. So if there is some block like this, then again patient may develop obstruction. So hernia is again an important cause. Then there are some pockets in the abdomen. So this is again called internal herniation if bowel goes through those pockets inside the abdomen and gets stuck. So these pockets may be present in some 2 to 5% of patients, and they may come up with no visible external signs, but there will be severe pain. But if we do a CT scan, we can easily diagnose the condition. Now, as I told, if there is a twist in the intestine, there is a free long segment which is mobile, and it may at times get twisted. So this, if it automatically gets untwisted, patient will have pain and then it will automatically resolve. But in some cases, the twist may be very severe and may need a endoscopic or surgical correction. Next, one important cause in children's is sliding of a portion of the bowel into another portion. So this is called intussusception. So you can see a portion of the bowel has slided inside another portion. This type of problem is more commonly seen in children following some infections and all. Then another cause is inflammatory bowel disease, namely Crohn's disease. So inflammatory bowel disease, as we know, is a chronic problem, and we can suppress the problem, but we cannot cure it properly. So what happens is multiple ulcers are formed. They gradually heal, and then again ulcers come. So in this process of healing and ulceration, fibrosis happens, scarring happens. So because of this continuous scarring, the lumen narrows. So you can appreciate that in the second picture, the lumen has significantly narrowed, and this can cause blockage of solid food particles, may leading to obstruction. Next, one more common in our country is tuberculosis. So again, tuberculosis, we all know that mostly affects lung, but it can affect abdominal organs also. So intestinal tuberculosis, what happens is mostly we can treat it by tablets. So rarely we'll come across tuberculosis causing obstruction. It can be in the neglected cases who have not undergone any treatment. There can be blockage of intestine, or sometimes after therapy, there is healing by fibrosis. If the healing happens normally, there won't be any compromise in the lumen. But if there is the bowel becomes rigid, and then there can be obstruction. Next, the most complex and the most important topic of today's evening's discussion is obstruction because of cancer. So what is cancer? So we can see in the normal tissue, there is continuous healing. The body tissue dies and it heals naturally. But during this process, if there is some defect in the healing process, there is proliferation of cells. This can places called stage 4 disease, where from one the cat to access, and it starts taking blood of place and starts to grow there. So this is the cancer. Now coming to what are the risks for bowel cancer. So advancing age. So after 50 years, the incidence of bowel cancer rises with every decade. So 50, then 60, 70, like that, the risk keeps on increasing. So we advise screening after 50 years of age. Next is the kind of food you take. So if you take red meat very frequently, if you take fried food, the junk foods, what we say, and avoid fiber-rich diet, fresh fruits and all, then next is alcohol and smoking. Then obesity. And next is exposure to radiation. So for any cause, if there is exposure to radiation, there is risk of. There are some increased risk apart from normal general population in certain patients. These are patients who have already had some cancer. If you have a family history, your parents or your brother, sister, anyone having, then obviously you run a risk of having cancer. Next is polyp. So if there is a polyp, so polyp is basically a small protrusion inside the colon. So there is hypertrophy of the normal colonic layer. So this left untreated can later on develop into cancer. Next is inflammatory bowel disease like ulcerative colitis and Crohn's disease, which again, if present in long run, increase the risk of cancer. So is the importance of regular checkup and screening. And next is genetic susceptibility, like the presence of a familial adenomatous polyposis gene or APC gene or HNPCC gene. Now, more important is how can you reduce your risk? So, reducing risk is by improving your lifestyle, the diet you choose, the exercise you do. So, one has to engage in at least thrice weekly exercise, try to have healthy diet as much as possible, increase the intake of fresh fruits and vegetables, increase the content of fiber, and avoid junk food, quit smoking and drinking, and also healthy body weight. Now, there's a very important slide. Early detection can save life. So if we can detect, we all know that cancer has stages, isn't it? So if we can detect it in an early stage, so obviously the chances of cure is possible. If done in detected in a later stage, the probability of cure from cancer is less. We can only give treatment, but we cannot ascertain cure. But if diagnosed in early stage, cure is possible. So for colon cancer, what is advised is a screening after the age of 50. So what are the tools we use for screening? It is simple stool test, which is stool occult blood test, or the FIT test, which is the immunochemical test, which is more sensitive and more specific and is used nowadays. So the stool test is advised yearly. Then we can do a sigmoidoscopy because most of these problems develop in the distal part of the colon. So a 5-yearly sigmoidoscopy is recommended. And then colonoscopy 5 to 10 yearly, depending on risk factors. Suppose if you have found a polyp in a sigmoidoscopy, then obviously we have to do a full colonoscopy to rule out presence of polyp in other areas. Now, as I told, there are various stages of cancer. So it starts from inside the lumen. So in stage 1 and stage 2, the disease is confined to the bowel only. In stage 3, from the lumen, it spreads to the lymph nodes. It goes outside the bowel lumen. So in stage 3 and stage 4, we have to do a very major radical surgery and also chemotherapy, or in rectal cancer, even radiation is recommended. So that is the important, that if we can detect it in an early stage, simple surgery can cure it. So if we see the lumen as a whole, it takes around 6 months for a cancer to spread 1/4. Another 6 months to go for half. So it takes almost 2 years to complete the full circumference of the bowel. The patient coming with obstruction will have full circumferential lesion. So any cancer patient coming with obstruction means it's an advanced stage. It has gone almost crossed 2 years most of the time. Very rarely it may be stage 2 disease, but mostly it is either a stage 3 or a stage 4 disease. Now, before reaching that stage, cancer will always give some warning sign. There won't be some drastic sign. That is the problem with cancer. So we get minor warning signs. So we have to know what are these warning signs. And if there is anything like a mucus discharge or blood in stool, if there is altered bowel habit, which means that you had a certain pattern of bowel habit, suddenly you start to see that you are passing multiple motion, it's not coming clear. After passing motion, you don't feel that it has completely come out. You have the sense of incomplete evacuation. You have alternate constipation followed by diarrhea. So these are things which is labeled as altered bowel habit. Then if you have recurrent pain, aches or cramps in the abdomen, which is because probably of partial or obstruction. And then if you have unwanted or unintended weight loss, that's a very important sign of not only bowel cancer, but other cancers also. So if there is a unintended weight loss of say 5-6 kilos or uh, over a period of 3 to 6 months, then it is a thing of concern. Next, another important sign is anemia. Now again, anemia is because there will be an ulcer, there will be small amount of minor bleeding which continuously happens from the cancer. So that can cause anemia, which is drop in the hemoglobin. So whenever you come across this encounter sign, any of them, not necessarily all, what you have to do is consult your doctor, explain whatever symptoms you have, and then according to your symptoms, he will advise tests. So basically, first we do a clinical examination and then we ask for some tests. So talking of obstruction, we do an X-ray. X-ray will show that the intestine are dilated. You can see dilated coils of intestine. Then a CT scan is done to exactly know which level the obstruction is, which organ is obstructed, how severe it is, or is it what is the reason for an obstruction? Is there any growth, anything? And then we can do a colonoscopy, which is direct visualization of the lumen of the bowel, and we can directly see the lesion inside. So we can take a biopsy, and finally the pathology cancer or whatever. So once we have got all this information, the beauty at GEM Hospital is that we have a group of doctors. It is not a single doctor who makes all the decision. So once we have all the thing, we discuss the case in our group. So it will have the radiologist, the medical oncologist, the surgical oncologist, and everyone will sit together and will discuss the case and further decide on the course of the treatment. Like how your treatment is going to be proceed is decided by a group of doctors. So that makes the decision complete, and it is evidence based, and has to be approved by everyone. So coming to management of obstruction, at times if it is a subacute obstruction, then we can go for conservative management, because many a times obstruction because of bands or minor adhesions can be treated conservatively without surgery. But many a times if it doesn't settle, then what we do is a laparoscopic surgery. So what we do is a small hole, and then we see inside what is the problem, and then we tackle with the problem. And open surgery is also can be done. But in our center, which is a center of excellency for laparoscopic surgery, and have been doing such complicated case for more than 30 years by laparoscopic means, our center prefers laparoscopic surgery. Why we prefer laparoscopic surgery? There has to be some reason. The benefits we have noted is that because we make small holes, there is minimum pain in the postoperative period, and there is minimum scarring. There is no big cut involved, so there is less risk of infection. And if any infection is there, then chances of hernias are high. So if there is less infection, obviously the chance of hernia also will be less. Then in laparoscopic surgery, there is minimum handling of tissue. So if the tissue is handled minimum, we precisely under high definition vision, we have 4K surgery, robot camera system, 3 system to visualize the problem precisely, and then we attack the problem precisely. So we need not handle much of the tissue, so recovery is fast. So it has been also noted that with early recovery and the immunity is also preserved. So we all know that how important is immunity for your recovery. So if the immunity is intact, obviously the recovery of functions will be fast. And if all these things happen, obviously your return to work will be early, you'll be discharged early, you'll be more comfortable at discharge. I thank each one of you for joining us today, this evening. And we are happy to inform that we are maintaining a very strict corona-free environment in our hospital. And we are taking all stringent measures so that our patients can come safely. And we are happy to say that we have performed more than 2,000 surgeries, many of them emergency, coming with obstruction, and we could be able to cure them with laparoscopic surgery in these challenging COVID times also. So I want to thank you for joining us, and I want to thank all these patients for giving us this opportunity, laying their trust on us, and we are happy that we could deliver, we could keep up to the promise. And with this, I would like to end my talk. I'll be happy to answer any questions, and at the same time, I'd like to wish all my listeners happy Ayudha Puja, Durga Puja, and Navratri at the same time. Thank you. And if there is any questions, I'd like to answer them. Okay, I have one question. Mr. Selva, he has asked that, uh, like, he has symptoms, but because of corona, he was avoiding. And is it that he can wait for few more months? It's very difficult to say from here exactly what symptoms you are having. And I can assure that we have entered into a time wherein we are partially, we have to be cautious, but still, since we are taking adequate measures, I would advise you to please consult with the doctor and at least have some investigation to find out what is the reason for your problem. And then from after doctor's advice only, you can take necessary like gap for your treatment, because if you don't treat it in a proper time, it may increase suddenly. And then now if we do the tackle the problem, it will be more of like what do you say, in a controlled manner. But if it becomes an emergency, then it will become difficult for your family members also, for you also, to adjust suddenly. So I think if you have minor symptoms also, it's better to consult. You can have teleconsultation also, and then further course can be decided upon that. Okay, 1 second. Sorry, 1 second. I'll just. See, one question is how to prevent bowel obstruction. Well, uh, see, there is nothing to prevent bowel obstruction when it has happened, but I have highlighted few causes. Like if you know that you are a case of inflammatory bowel disease, then you should continue with your regular checkup of your doctor, and they do endoscopy. And if there is any narrow on the limb, they will advise you accordingly. So basically, if you have some known disease, then you have to follow up with your doctor on a regular basis to see the progression of the disease. Similarly, if you experience any symptoms like whatever I have mentioned, occasional pain, cramp, any warning signs, as I have told. So any you have vomiting, abdominal distension kind of symptoms, then you should consult your doctor and find out exactly the cause. But if obstruction has happened, or if there is no obstruction, you can't say that do this to prevent obstruction. But as I have told that the normal lifestyle modifications to avoid bowel cancer. So after 50 years, if you want to prevent, it is not that you should be taking precaution at 50 years. The precaution should begin early itself. You should always try to maintain a healthy lifestyle. Next, one question is, heavy weightlifting will also cause bowel obstruction? Not directly, but if you have a hernia. So if you have a hernia and you are lifting a very heavy weight, so it will increase the abdominal pressure. So if it increases the abdominal pressure, then suddenly a portion of the bowel may come out, and which may not reduce by itself. So if it doesn't reduce and stays there for a long time, definitely it can cause obstruction. Yes. Then can IBS cause obstruction? No, usually IBS is irritable bowel syndrome. It doesn't cause obstruction as such. It will cause minor symptoms of cramps, occasional diarrhea, flatulence, dyspepsia, bloating sensation, and all. But it doesn't cause, IBS doesn't cause obstruction. Most common complication after surgery is bleeding or adhesion, doctor. It depends from surgery to surgery, but then definitely if you have undergone a open surgery, the risk of adhesions are higher than if you have undergone a laparoscopic surgery. And bleeding is again a different complication. So it is not that all surgery will have risk of bleeding, but there are some surgeries which, if we handle blood vessels, we are cutting, dividing blood vessels, then definitely post-op there is a fractional chance of bleeding. How to identify acidity and hyperacidity? In acidity, you'll have symptoms. No, you'll have burning sensation in the stomach. So upper abdomen, you'll have burning sensation. Morning, you'll have reflux symptoms. You can have something very sour in taste coming into the mouth and all. So those are the symptoms of acidity, and usually we prescribe antacid, but as such we can do an endoscopy to see if there is any side effect of acidity like ulcer formation or something. Okay, next is gas trouble, toxic gas, acidity, most common, always it can cause sudden heart attack. See, gas, it is a common misconception that gas can lead to heart attack, but it is not like that. Basically, when a person experiences a heart attack, he has that feeling, because heart also is a midline structure, almost towards the midline and left. So during a heart attack, there is a sensation of discomfort in the upper abdomen. So most of the people correlate this discomfort as acidity or gas. So this has to be known. So if you experience something like that, definitely you have to consult your doctor. But it is not directly correlated with heart attack. Cancer patient, how can prevent corona? So all the necessary precautions which you have taken. See, cancer patient means if you have undergone a chemotherapy or radiation, or if you've undergone a surgery for cancer, initial few months, your immunity will be down. So any patient whose immunity is down, the risk of corona infection is high. So you have to take precaution. You have to isolate yourself. You have to use mask. You should not be going outside. So you have to take all the necessary precaution, hand hygiene and all, everything which we all know. Over these few months we have been maintaining all these hygienic methods to prevent corona. The same thing will have to exercise, so that since your immunity is at is down, so you will be at a higher risk. So you'll have to be more cautious. Care, and you have to be cautious. How can sleep gastritis problem person? I believe you want to ask that reflux symptoms during sleep. So if you have during sleep you have acidity, food coming up, these are symptoms of reflux. So there are certain precautions for these kind of patients. So you should have small meal. You should not right after the meal you should not sleep. And the bed should be a little bit elevated. You should avoid smoking, avoid coffee or something at night. And then additionally, after consultation with doctor, there are some medications. And even if it doesn't settle, then obviously we do an endoscopy to test how severe is the reflux, and accordingly we give treatment. Medication required for gastric ulcer problem. Yeah, till the ulcer heals, definitely you'll need some medications. And once the ulcer has healed, you don't need any medication. You have to find out what was the cause for ulcer. At times it can be because of some bacterial infection. So if you treat the bacterial infection, it will automatically get healed. Sometimes it is because of irritability of the stomach causing more acid secretion. So you have to find the reason why it is getting irritated. Is it because of some food which your body doesn't like, or is it because of the stress you are undergoing? So accordingly, we give medication and treat the problem. Can ulcer patient do exercise? Yes, ulcer patient can do exercise, but yeah, ulcer is not something which will be there continuously there. Once you have taken a medication, the ulcer will obviously go off, because body is naturally continuously healing. It's not that once a ulcer is there, it will always be there. If after proper medication, if we do an endoscopy, we can see complete resolution also. Gastric problem person, how to drink water? Okay, what I get is maybe that getting infected from water. So we know that many of the bacteria like Helicobacter pylori causing ulcers come from water which is not properly like directly from the well or tube well water if you are drinking. So there is high risk of getting infected. So the water should be boiled and drank, or nowadays everyone is using this RO water. This, so if we drink clear water, means purified water, we don't run the risk of having this infection. So if you have had an infection already and you have treated already, so you should take necessary precautions so that you don't reinfection can always occur. It's not that once you have treated the don't come again, because if you again drink infected water, obviously it will again come. Best food for bowel health, doctor? Yeah, that's a very good question. So I have highlighted that the food should be consisting of fruits and which are high in nutrients, antioxidants. It should be high fiber so that you have a decent amount of stool and then there is no constipation. So if you are constipated, if the toxins which are present in the stool stay in the intestine for a long time, then there is risk of having cancer. But if your bowel habit is regular, because you are taking adequate amount of fiber, adequate amount of water, fluid, then the risk of cancer is definitely low. Then you should avoid smoking, drinking, all those kind of things, along with exercise and maintaining a healthy body weight. So I think that's it for today. Once again, thank you. Thanks for joining this evening. And I hope I could spread some awareness. And I hope that we could continue to serve our patients in these difficult times also. Thank you for laying your trust on us. Thank you once again and wish you all a happy and a healthy life. Thank you.